Hello, and welcome to the latest video from Adolescent Medicine Consulting. For those of you who are returning, thank you for following. For those of you who are new, my name is Mira Bihari. I am a pediatrician and adolescent medicine specialist with over 20 years of experience helping teens, tweens, and young adults live healthier lives. This video is part of our series, What to Do When, which goes through the classic adolescent psychosocial assessment to give you tools to address positive responses. This week, we are talking about D for drugs. For information on the other psychosocial questions, please check out some of our earlier videos. As a reminder, these videos are for informational and educational purposes only. They are not a substitute for your own clinical judgment and are not a medical consultation. If you have a specific concern, please reach out to us directly through our website, adolescentmedicineconsulting.com, or through the platform where you watch this video. According to data from the Youth Risk Behavior Survey, the YRBS, which is a national survey conducted every 2 years in American high schools to assess the health and risk behaviors of American students, overall, youth substance use is decreasing. Unfortunately, deaths from opioid overdoses are increasing among American adolescents and are now a leading cause of death. According to a recent article by Dr. Joseph Friedman and Dr. Scott Hadland, published in the New England Journal of Medicine, approximately 22 adolescents die every week from an opioid overdose. That's the equivalent of one high school classroom of young people dead every week from a completely preventable condition. Having Narcan, naloxone nasal spray, available can help reduce deaths from overdose. This medication is now available over the counter, is easy to use, and can save a life. Now that we have a sense of the scope of the problem, let's figure out how we can assess the risks for your patients. In the last video, we discussed the stages of adolescent psychological development. While there are more targeted questions you can ask, I find the following questions are appropriate for most young patients you may see. Depending on the age of the patient and your comfort level, as well as your clinic policy, you can ask these questions with or without a parent present. What do you know about alcohol? What do you know about drugs? Nice, open-ended questions that give space for the young person to share what they do or do not know. It's a great opportunity to dispel any myths and provide some anticipatory guidance. Other questions you may ask are, what would you do if someone offered you drugs or alcohol? What would you do if you were at a party and your friend was using drugs or alcohol? As discussed in the last video, the adolescent brain is still developing. By asking these questions when the patient is in a relatively low anxiety setting, your office, you can help them develop their prefrontal cortex. This will help them have more tools to use when they are in a high stress, peer pressure situation. One tool that I was recently reminded of by my friends Dory and Lamar Collins is the nice way to say no. I first learned this mnemonic from Dr. Alma Golden, who had learned it from a health educator, and then we taught it to kids at a community organization, and now I'm sharing it with you to share with your patients. I just love the way knowledge circulates. When I was a kid, the phrase, just say no, was popularized as a way to respond to someone who offered you drugs or alcohol. The nice way to say no expands on that. We start with actually saying no. You'd be surprised how many times people think they said no, but they did not. Then you add in an I statement. I care about my health and know that drugs will hurt my body. You see, change the topic. Hey, are you going to go to that pep rally tomorrow? If the person offering you drugs, alcohol, or whatever it is that you don't want to do persists, then you exit. Leave the situation and get yourself to a safe place. This is a practical tool that you can teach patients and their families in a few minutes of a regular office visit. I hope this video gave you some tools to help the teens in your practice and in your life. I recommend trying out these questions with your patients this week, especially with patients who you think are low risk for substance use. It'll help you get more comfortable with talking about these topics and may help you pick up on some unknown risk behaviors. I recommend finding out what substance use treatment services are available in your area for young people. If you need help locating resources, contact us at Adolescent Medicine Consulting. Might also be a good idea to have Narcan, naloxone nasal spray available, not just for teens, but for others. I have one colleague who had it available and was able to use it to save her neighbor's life. Thank you for tuning in. I hope you'll join us next time for more tips and tools from Adolescent Medicine Consulting to help you help the teens and young adults in your life.